Systems Thinking, video number 3. Let's take a look at complex systems and how do they actually differ from simple systems. Simple systems do have parts. They have relationships. Usually they're linear relationships, but they also have a centralized control. Whereas when you look at complex systems, they too have parts, many more parts. They have relationships, whether they're linear or nonlinear, direct or indirect relationships. And usually that centralized control that was so successful in the simple furnace system example, many times there's a decentralized control system. And when you take a look at that, take a look at our healthcare system. You got payers, you've got the providers, you've got the hospitals, you've got the long-term care, and you've got rehabilitation. All these different parties, all these different parts, they all are interrelated in different ways. And it gets to be more complex, especially when different people control the payers, different people control the hospitals, and different people control, the providers and then you throw the patients in there too, and they're kind of stuck in the middle. So that's why it's important that when we make a change to a healthcare system, it's going to have other ramifications down the road. So it's important to take a look at systems and think about systems and the big picture. When you make a small change in one part of it, it can have some major ramifications down the road. So how do we evaluate some of these systems? I challenge you to consider this healthcare system model framework. It covers a few areas that, it's interesting when you look and evaluate a system, how things change. Let's take a look at the leadership. Leadership includes policy, includes the actual leaders themselves. It also includes laws, regulations, things like that. And in a complex system, you're going to have multiple leaders. Let's take a look at the structure. How is that physical structure? Is it conducive to the flow of patient care? How's the organizational structure? Is it organized for the organization, or is it organized around the patient? How about the competency of the staff? Are the nurses competent in what they're doing? What training programs are in place? And look at processes. Are their processes efficient? Do they have some inputs? They have no outputs? Just a total waste of time. And how do they leverage technology? Is it for the better for healthcare? Does it make life simpler? Does it make it better, higher quality? And then how is it budgeted?